All right, so we'd like to ask everybody to, for now, kindly please mute your microphone. You may opt to turn your video on if you have good internet bandwidth. Please ensure that you have a stable internet connection. Participants are encouraged to rename yourselves in the chat room as first name and last name, and then your affiliation or your facility. For any questions that may arise during the session, kindly type your questions in the chat box. Also, later on, we will be sending a link for the attendance form. It will be also pasted in the chat box. Kindly fill that out, please. Next slide. All right. So I mentioned that we have a jam-packed agenda today, and here it is. So I'll begin with a little bit of session recap from the second CMM QI Learning Network, and then we'll have Ms. Gabrielle Chan present her research findings on reaching the third 95 target in the Philippines, followed by our network's data updates by our QI specialist, Sir Ilder Waya. And then we'll have our first presenter from the participants. Dr. Belian will share BRHMC hack best practices. After the bio break, we'll hear from Dr. Stan Carrascal of FHI regarding viral load for all. Followed by the second presentation from our participants on DRMC Hack Team's best practice on adherent support documentation by Dr. Osabel. Later on, we're going to hear about updates from our drug-resistant group services, specifically Sir Tim Dizon from RITM. From the same institution, we will also hear from Dr. Desi Roman on site-level processes versus systems. Then we'll now go into our subject matter expert, Dr. John Sumowski, still on the topic of drug resistance, because this is something that really is a topic in demand from our participants and also will help in our QI processes. John and Emma will help us learn more about viral dynamics and transmission, how resistance is generated. And then we'll have a Q&A session, which will be presided over by Dr. Janice Kawili. Okay, next slide, please. Okay, just a quick recap on what happened during the last session natin. Sige, let's go on to the next slide. So if you remember, we had a case presentation of a patient with multiple shifts of medication due to different reasons without viral load guidance. And this talk was presided over by Dr. Jonah Atun, wherein a root cause analysis for the issue at hand was demonstrated. Next. During our didactic section, we were given a case with multiple mutations. And we were given the information of the most common mutations. And when given such information, we were taught how we can analyze this using the Stanford HIV database. We will see that we had minor mutations and polymorphisms, but it is important to focus on the important mutations and the significant ones. In the small box there, we note what are the mutations that sort of complex medical management should be able to know, be familiar with, because these will appear in most of your resistant cases. So key mutations may be K65R, M184V, K103N, are just a few of these examples. And the lesson learned from this discussion was what regimen should be considered in a patient who presents with multiple mutations, even in those protease inhibitors. No, so protease inhibitors are our second line drugs, and a mutation in such class is something that we are actually fearful of because it limits really our choices. And given this very difficult case, we were taught by our subject matter experts on how to best approach it. And that was a summary of our second session.